So somebody asked me recently on one of the forum pages if I ever get brain fog, and the answer to that question is yes. And in the previous clip, I definitely said that PICC lines are inserted in central veins, and they are not. They are inserted in peripheral veins, and they are called peripherally inserted central catheters. So please, please remember, they are inserted in peripheral veins, usually in your arms, not in central veins. So what are the other risks of having a PICC line? The next big one is blood clotting. So the reason for this is that, you know, a PICC line is essentially a long, flexible tube that is hanging out inside of your vein. And, you know, there's lots of blood cells sort of swimming by. In my mind, blood cells actually swim. Of course, that's not actually what happens, but whatever. So anyway, they're swimming. And blood cells like to stick to things. It's one of their design functions. You know, they're designed to sort of adhere to surfaces, particularly if that surface is not native to your body. So as, you know, blood cells are sort of swimming by, over time you're going to accumulate sort of this sheath of cells on the outside of your line. So pretty much everybody who has a PICC line is going to at some point develop what's called a fibrin sheath, which is essentially like a baby blood clot, I guess. Like, sort of has the same characteristics, but like isn't like hard enough to really be serious to your body, but like is serious to the function of the line. Okay, so when you tend to notice that these things are a problem is like when you have no problem flushing, you know, flushing the line and pushing, you know, liquid into the line is no problem. But when you try to draw back on it to see if you have blood return, you feel this pressure. And that's because, you know, you've essentially got, you know, like a tube, right? And then you've got sort of these like blood cells that are sort of like hanging on and like moving in sort of like the stream of your blood flow. And then when you draw back, it creates a, you know, a pressure gradient that causes this to come down on top of the line. Okay. But when you push fluid through it, it just pushes it back. Okay. So that's called a fibrin sheath. Now, over time, you can develop a true clot. Okay. And blood clots are, you know, blood clots on PICC lines are definitely one of the more common reasons for people to have their lines pulled. And, depending on where the clot is and sort of the structure of the clot, it may be permanent. You know, sometimes you get a clot inside of the line. This is why a lot of us use heparin. I know not everybody can, but I use heparin. I lock my line with heparin, which is blood thinner, to prevent sort of the clotting action and to decrease it. I know that not everybody's able to do that, but you know, it's also possible to form a clot on the outside of the line that causes the line to adhere to another structure in your body, like to the side of the vein. And if that happens, you may not be able, you know, removing the line may not resolve the clot, essentially. So you could end up with a permanent blood clot. That is a risk. Another risk of having the PICC line is that, you know, you have to be super careful about like lifting things with your line for a few reasons. So, you know, you're not supposed to lift, I think it's like 10 pounds or whatever with that arm, for a sustained hold. And again, there's sort of like different ideas of like what that is. I can tell you, I just really don't carry anything heavy with that line. You know, like I exercise if I'm able, but I just don't carry anything heavy with the arm that has that line in it. But the reason for this is, well, there's two reasons. One is because it can pull your line out partially, you know. The other reason is because it can, you know, your PICC line is sort of sharing space with your vein, with your blood in your vein. Okay, so like the vein is sort of like the outside tube, and then there's like the PICC line, which is like, you know, inside of that bigger, you know, that bigger tube, and then there's sort of, you know, blood, you know, moving by. And if you're flexing your muscles, it can sort of clamp down on that vein, you know, and push it right up against the sides of that PICC line and prevent blood from getting by. So if this happens, you know, for, I don't know, 5 seconds or something, like, it's, you know, it's not that big of a deal, right? But if you use that arm a lot and it happens a lot, you know, it can start to cause, you know, the issues that you would see if you didn't have circulation to essentially the lower part of that limb, you know. So like if you suddenly no longer had effective blood flow, you know, to the lower part of your arm, you know, like what problems would be caused by that, you know, is also another risk. So for this reason, people who have PICC lines have to be very careful with exercising, and it is one of the biggest restrictions, and it can be kind of frustrating. All right, another thing that you have to be very careful about when you have a PICC line is getting it wet. Okay, so when they first put my line in, so I didn't have any problems when they put the line in. It was like, this is like sort of a funny story, actually. It was put in by the interventional radiology team, you know, at, you know, a hospital that like is very well versed in, you know, like mast cell disease and everything, right? You know, I have like all my doctors there and like all of my files there and whatever. And, you know, this poor physician's assistant who was like very new, you know, and like, you know, I mean, like she did a great job. Like she obviously knew what she was doing, but had never seen anybody with mast cell disease before. And it's sort of been like warned emphatically by, the IV nurses in the infusion center that, you know, I, you know, could anaphylax and, you know, did anaphylax, you know, sometimes. And, you know, sometimes it was not to anything that was really obvious. And, you know, I had to take a lot of medication for that. And, you know, it could be a problem. And like, there could be a possibility that like I anaphylaxed during the procedure, even if she did everything right. So this poor woman called me, in like the days leading up to me getting, my PICC line. And she was like, so listen, I don't want you to be like nervous or anything, but I think I'm going to just schedule your PICC line insertion in the emergency room in case I need a crash cart. And I was like, all right, I mean, like whatever you have to do to like feel comfortable, like, I don't really care. Like, it's fine. But you know, like, so I didn't have any actual problems with inserting the line, but so whatever. So the line goes in, it's great, you know, it works and like all that stuff. So, you know, she starts sort of telling me about all of the precautions and she's like, oh, you have to be very careful about getting it wet. And I was like, okay. And she's like, so when you take a shower, you know, wrap it up with, you know, like a saran wrap or something or whatever. And then like put a plastic bag over it and like tape the bag. And I was like, this does not sound efficient, you know, at all. So, my infusion nurse came to my house and I was sort of telling her this story and I was like, I haven't showered yet. And I'm all like terrified. I'm going to like, you know, wash off my PICC line or something. And she was like, oh no, you should get a cast cover. And I was like, all right. So I got, you know, just like a rubber cast cover and it works great for showering. It really does. But swimming is one of the safer types of exercise for me. I also have some, connective tissue issues and, you know, I really like to swim and I have a pool and, you know, obviously, you know, I was like pretty bummed about the fact that like I couldn't, you know, swim because I had the PICC line. And, I was also talking about the fact that, you know, I like to go and sort of do, you know, summer things. Like I want to go to a water park and whatever. And, somebody online recommended Dry Pro. And I'd never heard of this company before, but, you know, I mean, I'm totally willing to spend $40 to maybe be able to go swimming. So I ordered one online. I like measured my arm and everything. And it's essentially just like a rubber cover. I'm not sure what it's made of, but it has a bulb and you sort of suck the air out. I'll just put it on and video it so you guys can see what I'm talking about. But it forms like a seal. It sucks all the air out. So it forms like a seal, to your arm, and so there's no room for water to get in, and I can go swimming with that and it's great. You know, you need to take it off about once every hour. It gets kind of damp in there because it gets sweaty, and you have to be careful of that because that can also actually cause your dressing to come away from your skin, so just sort of keep an eye on that. But I actually am going to a water park tomorrow with this thing. Like, that's, you know, how comfortable I feel with it. So the good news is that, you know, while you absolutely do have to keep it dry, because it can cause your dressing to come away from the skin and sort of expose everything, there are good options. You know, you can't sort of wear them all the time, you know, but, you know, there are good options for you to sort of, you know, take a bath or, you know, go swimming and sort of like live a normal life. Guys, so check back in later on in the week when I talk about, like sterile dressing changes and how to access your PICC while keeping it sterile, for infusions or for push meds. If there's anything that you guys want me to address particularly, just let me know, put it in the comments or send me a message or whatever, and I'll try and get to it. Thanks a lot.